Okay. Good morning, all. Welcome to the Resilient 305 Climate and Heat Health Task Force. This workshop will be focused on the emergency preparedness and response related actions and concerns related to extreme heat. This is the third of 6 public workshops that is being hosted by the Miami Foundation with strong support from Miami-Dade County. I'm Jane Gilbert, the Chief Heat Officer for Resilient 305 and Miami-Dade County. Today, our agenda is I'm going to give an outline of what we're working on already within emergency preparedness and response, some of the things that are in the works to increase our preparedness and response, and share some best practices from other communities. My presentation will be about 20 minutes, and then we will have 4 breakout sessions. I usually had an agenda on this one, but I apologize, I don't. But we will spend 20 minutes in a presentation, about an hour in 4 breakout groups. Each breakout group will be discussing the same questions. You will just be directed to it. And then we'll come back for the remaining 10 minutes to have brief summaries of the breakout sessions. The PowerPoint and the collective notes will be featured included on the Miami Foundation Extreme Heat website for you to be able to see and future. And just so you know, in terms of this PowerPoint, it will be there, so you don't have to take photos and furiously take notes. So in the presentation, we're just going to briefly go over extreme heat risks, our current policies and procedures related to heat response and emergency management, and talk a little bit about our heat season campaign as it relates to preparedness, the enhancement training we're working on in terms of our citizen emergency response team training, and look at the specific risks around the combination of an extreme heat event with a power outage, and also talk about what we're doing with resilience centers, and as I mentioned, some best practices from elsewhere, and then we'll go out into breakout sessions. So many of you are part of the task force. Many of you have attended previous meetings and are very involved, but I want to make sure that we just briefly mention that extreme heat is the leading weather-related killer in the United States, and we are increasingly gathering more information with our research partners about exactly the number of heat-related illnesses and deaths that happen in the United States and in Florida and Miami-Dade in particular. But the recorded amounts we know are a fraction of what the actual illnesses and deaths that happen with heat. In Florida and in Miami-Dade in particular, the combination of our high humidity and high heat can lead to heat-related heat cramps, heat exhaustion, heat stroke, particularly for infants and very young children, pregnant women, older adults, outside workers, outside athletes, people recreating outside, people with disabilities or pre-existing conditions, people on certain prescription drugs. And it can happen in homes with little or no AC, at the workplace that could be outside or inside with little or no AC. Come on. Cars, etc. I'm just going to ask any of those who are on, who don't have their thing on mute, just to put it on mute for now. So most of those are preventable with education and certain precautions taken into account. Our National Weather Service has done a great job of helping create some visuals to understand the combination of heat and humidity, the heat index that creates, and the kinds of levels of precautions we should take at heat indices of 90 and above, 103 and above, 105 and above, or beyond. In Miami-Dade County, and this is really determined by the National Weather Service's regional area as to when they would issue a heat watch advisory and warning. This does not mean that the National Weather Service does communicate daily hazard reports at levels lower, with a heat index lower than this, but this is when they're reaching out to emergency management and engaging them. First, there's a heat watch and advisory. The heat watch is anywhere from 12 hours to 2 days before the expected event. Heat advisory would be within 12 hours of expecting a heat index of 108 degrees Fahrenheit or higher for at least 2 hours, and the excessive heat warning would be issued at values of 113 Fahrenheit or higher for at least 2 hours with a certain percentage of occurrence. In the event of either the advisory, watch, or warning, there would be automatic communication sent out to Miami-Dade alerts and through their internal media. You can sign up for that at miamidade.gov. And this is reminding me that Isabel Gandara, our intern from MIT, is just put in the chat the link to that. I want to thank her for her work in helping to prepare this PowerPoint today. She's done an amazing job doing the backup research to support this. Our current procedure at the heat advisory, the duty officer would be reaching out to the lead forecaster and making sure they are communicating the right information on what's anticipated in terms of temperature, humidity, heat index, and the timing. And then with the heat warning, that's when they would kick into effect of reaching out to our homeless trust and making sure that the homeless are reached out to consider opening shelters, getting them into spaces, consider which of our libraries, parks, and other spaces would be opened as cooling sites, and informed, make sure that our 311 would have that information on those shelters and cooling centers, and that the public information officer would issue a media release, including actions for people without AC, and that would be distributed not only to all the county agencies, but our municipal partners as well, some of whom are on this call. So we're looking at one of the, key prevention is awareness. And luckily our heat season, luckily or unluckily, our heat season is aligned with our hurricane season. The benefit of that is we already have done an incredible job as a community raising awareness about what to do to prepare for hurricanes and what to do in the event of a hurricane. We can piggyback on that with some of the heat related, and we've included some issues of heat concerns during hurricanes in the guide that will go out to every household in Miami-Dade County. And we're currently working with our emergency management office on various ways to add heat to our various outreach around hurricane response. We're also going to have a heat media day, working with our schools, and really just elevating the level of response and awareness, particularly with our at-risk groups, and going to create some specific messaging with that and with our healthcare workers. Another issue with emergency management is to incorporate heat into our hazard mitigation plan so that we may access FEMA funding and for some of these initiatives. This would be really a plan building off Miami-Dade's existing capacity and experience for emergency preparedness and response, and make us eligible for that funding. The local mitigation strategy has already agreed to move forward with this, and so we're in a good place to move that forward. And some of the work that we're working on with Dr. Chris Ujo and Julia Martirano for heat health assessment will support that, any updates to the hazard mitigation plan and previous documents that feed into that. So we can certainly use our existing emergency notification systems to elevate the perception of danger due to heat and to notify the public even before an excessive heat warning. We don't need to kick all the emergency procedures in place, but to make sure that we inform people, since we know that most heat-related illnesses actually happen at levels lower than certainly a heat index of 113, but even lower than 108. One of the other things we're working on with our emergency management partners is to provide an enhancement level of training for our citizen emergency response team volunteers. These are volunteers that take a training that's a combination of now of online and in-person training. It's open to any individual community member in Miami-Dade County, and it really prepares them for all disasters, but this will have a specific heat component. We're currently just updating that, and we'll also provide it not only in the initial training for volunteers, but also as a component of refresher training this spring. And with that, the volunteers that attend will also receive a kit with key supplies to help in their efforts to keep people cool. Ice packs, cooling towels, the cooling rehab chair will be held by the CERT team coordinator at the county and used and deployed at major events and areas where they have volunteers helping with response. So that might be at a marathon or a festival event, areas where we know there's a higher risk for heat-related illnesses. So I want to talk a little bit about one of the biggest emergency-related disasters concerns related to heat. You know, in Miami, we have chronic high heat, which we're generally pretty accustomed to, have a lot of systems in place in terms of air conditioning and just regulating our days to address that. Certainly outdoor workers and people with inadequate AC are still vulnerable. We do have sessions coming up, public workshops coming up, both on outdoor workers and housing and on urban heat islands. So those are the three coming up. If you're interested in specific actions related to those, I encourage you to come join us. But in the event of an extended and widespread power outage, we have many more people at risk for heat-related illness, not having access to air conditioning and artificial cooling. Luckily, after Hurricane Irma, the state did require that all assisted living and nursing homes have backup generators with enough power for 3 days to keep a common room cool. That has our city and county partners have been working hard to enforce that and make sure that's in place. But we still know we have a large population that doesn't have access to that backup power. So those are some of the things we need to look at in terms of our cooling centers and evacuation shelters, making sure that they have that energy redundancy to to handle the cooling needs during this time. One of the options with many of our evacuation shelters are public schools, and the Florida Power and Light, in their recent rate case settlement, agreed to pilot outfitting some of these shelters with solar and battery backup. This would be a great thing to explore. It also might be something that we could explore with other grants, such as those hazard mitigation grants, since it could stand to save many lives. Another initiative that we're partnering with the Adrienne Arsht Rockefeller Foundation Resilience Center is a grant from the state of Florida, Rebuild Florida grant, to create a countywide plan for resilience hubs. These might be existing designated cooling centers where we would outfit them to have that backup power to serve many different types of disaster preparedness and response activities, but including being able to serve the community with our increasing days of high heat, and certainly during the event of a power outage. That planning will be kicking off late spring this year. The city of Miami also has a Rebuild Florida grant that's building a resilience hub in Liberty City with that backup power. The Arsht Rock Resilience Center has also piloted a community resilience pod, the first one here in Miami-Dade. They're an international organization, but they have a strong partnership with Miami-Dade County. And part of that study will look at the joint interaction and facility needs of both the resilience hubs, which are permanently situated facilities, and a resilience pod that could be moved to any site to respond to a disaster. And they're now being outfitted with backup power and cooling stations. So some of the other best practices we've seen in Toronto, Philadelphia, New York. Toronto and Philadelphia had a heat line during heat advisories. This is something we could really use our 311 and planning to. We've been talking to emergency management to have ongoing language of what to do in the event of different levels of heat indexes in the county. New York did as part of their sort of heat season awareness campaign, a Be a Buddy program for encouraging New Yorkers to think about their neighbors, their friends, family members that may be high-risk individuals, and how do you check on them. In the Chicago heat wave, there is a known study done of two similar neighborhoods where one had a very high social capacity and they had a much lower level of heat-related illnesses and deaths than another neighborhood of similar demographics, but had not as much of that social capacity. So this Be a Buddy kind of program can be very effective preventative measure. And we're also working to create some enhancement training with our emergency responders to have them make sure they're asking the right questions and thinking about what complicating factors could be happening during higher heat conditions. So with that, we have 4 breakout questions. And as I mentioned, we're going to be breaking out into those. You have just under an hour to have those discussions. Each group will have a facilitator and a note taker. The first question is, what additional procedures and measures do we need to ensure the safest outcomes in the event of an excessive heat event? So this is really getting into how do we enhance our procedures manual, our emergency management plan, any advice you have. The next one is, how could real-time monitoring and reporting of heat-related illnesses, otherwise sometimes called syndromic surveillance, be used during summer heat for preparedness and response? The third question is, how do we know what the current perception of the threat of extreme heat is with vulnerable groups? This is really, each of you have connections to the community, have done outreach in the community. Many of you have anyway. And we're trying to learn from you what you think is our community's, the most vulnerable groups' largest concerns, or is this even really on their radar? What level is it on their radar? And then finally, since we're looking to enhance and expand our CERT volunteers and team development, would benefit from all the participants' recommendations for enhancing and enrolling more active volunteers in the communities, particularly in the communities that need it the most. So with that, I'm going to ask Chelsea Clark to send us to our groups. I think we're getting all back here. Thank you for all your contributions. If your group was anything like ours, I got just a large amount of invaluable input. We had extra time with these questions, so we're learning each time where our questions are. And other breakouts, we haven't had enough time. So, but I'm curious how the other groups went. Just briefly, in terms of the first question related to additional measures and procedures of safer outcomes, we talked about making sure that our tourists were engaged and informed, the access to different apps like a heat index app and response, and making sure our other nonprofit partners are engaged on the information when heat events happen. One of the ideas of real-time monitoring that came up was to make sure that healthcare practitioners are informed when heat indexes are higher, so that in real time they're thinking about that exposure and potentially recording it. And I shared also from our a call I had with the Department of Health and Human Services last week, to look at it in some communities. They're trying out having a timestamp on all hospitalizations that would include the weather of that day, so that future research it would have. But real-time monitoring, we do have at least a daily download called the Essence from the health department daily basis that we could also take access to. So those were really helpful. In terms of the perceptions of the current threat of extreme heat out there, certainly the concerns from outdoor workers featured high as their real experience of heat stress, not just physical, but emotional, how that impacts them on a day-to-day basis, not only at their work site, but also as they're going around their daily activities, was something that was more and more aware. The financial burden and the emotional burden of heat came up a lot. The financial burden with utility costs and people not being able to keep their places cool as something that was also a piece of concern from our most vulnerable communities. And then in terms of the CERT, we had lots of engagement of ideas from Rotary clubs and veterans to young people, and making it cool and recognizing our CERT team members when they're doing it so that we raise visibility for the program. Some feedback as COVID hit and the CERT trainings had to go hybrid, that lost accessibility for some because they couldn't have access to the online as long. So that's something we need to think about. The CERT manuals are available in Spanish, but there hadn't been some trainings recently in Spanish. So we want to make sure that we're offering Spanish and Creole for those trainings, reaching out and making it something that could be a credential for a young person. The connection, the young people are very concerned about climate change, really the connection between climate change and this emergency preparedness and response. Could be people interested in a medical career, that this would be great building block for them to engage. So we also got into other partners and the importance of really investing in our cooling centers and resilience hubs as social hubs for preparedness and response. So with that, it was a great discussion. I don't want to take up too much time because we want to turn it over to one of our other facilitators here. I'm seeing Galen. So Galen, you want to share from your group?
Yeah, I think, we had some similar things, but there was a lot of discussion about communication and how we get the right message to the right groups, and that they're just not the same. But there are potential partners like the military installations. So Pamela was sharing that they are going to be doing a resilience assessment and can include heat, and that those are really like parts of our community. So that is useful. We talked a little bit about, can we partner on apps for doing monitoring? Are all these tech people that are coming down here, can they help us out? Can that be an expectation for them? How do we make that an expectation that they participate in this? Chris was sharing that what we know is that, say even if 68% of people know that a heat event is coming, only about half change their behavior. So we know that the majority of people aren't changing their behaviors, and we don't have that much time, even just a couple of days to communicate that.
Right.
Yeah, so kind of some of those things. I think there was on CERT, there was a point that using cohorts and teams based in specific locations will probably help. So churches and other groups. And then there was some discussion of how maybe we can use CASD and some of the existing parks programs and CUA, the cultural affairs, because they interact with summer programs, and we should align that communication.
That's a great idea.
And I think
for those who don't know, is Community Affairs and Human Services Department, which has relationship with many social service agencies. So that's a great idea.
And then also some suggestions to look to other cities, which I know we're doing, but Phoenix and in the Pacific Northwest for what was challenging, and that there should be some transparency in our communication as we go forward, as much as possible.
Yes, Nicole.
About the challenges, not just the opportunities.
Yeah, that's good. Yes, Nicole.
So we heard a lot of the same things. So just to add to that, there was a lot of discussion about making sure that we are connecting with trusted community partners, the organizations, and the residents, so that they can be the ones that are communicating and participating in the CERT training. Also looking that it's important to provide incentives or services for those who are taking the CERT trainings to make sure that they have childcare, perhaps some food since it's offered in the evenings on the weekends. And also, what I didn't hear in the other groups is making sure that we are educating the employers and utilizing them as a way to educate their workers and also to get that information about those heat-related illnesses and impacts. Just the Miami Climate Alliance said that they're on the ground. We know they work with the community a lot. They did a survey, and extreme heat was the highest ranked threat or concern for the participants. And they also hear that in their general meetings and interactions with the community. So it is a concern. And then just making sure that we're identifying those areas that have gaps, that may not have cooling centers or have the locations where these cooling centers could be established and points of conversation. So thinking about like the barrier islands, for example, Miami Beach mentioned that normally for a hurricane, for example, they encourage folks to go off the island. So they may not have as many locations identified at this point. So there's opportunities for identifying locations that aren't there. So that's about it for us.
Great points. So much to add to what you said that triggered me, but I want to turn it over to Sandra.
Thanks, Jane. I won't take too much time because I know people are anxious to get to lunch, but so many great points in our group. We talked a little bit about the data gap of acute incidents of extreme heat versus long-term exposure to extreme heat, and how that's sort of different in our community, and the need to really look at the effects of long-term exposure. We also talked a little bit about perhaps developing an app similar to the IC Change app, where people could record ambient temperature using their cell phone and share stories or pictures during extreme heat events to collect data that way. And then we also talked about communications quite a bit as well, similar to Galen's group, and the best ways to reach different populations and the importance of education before, during, and after extreme heat events. And then we also talked about making our search trainings more accessible by hosting them in more locations around the county and close to transit, and providing childcare or other options to make them more accessible to more people.
Great. Awesome. All great advice. And I just want to highlight to all of you that Isabella has put in the chat again how you can sign up yourself to learn more about CERT trainings and forward that to others. Really valuable input. If you have follow-up thoughts, you can email them at resilience@miamidade.gov, and you can continue to engage with us in future workshops. The next one is the February 8th, I think. It's February 8th. It's on outdoor workers. So please sign up for that. Please let others know about it. Really, thank you all for this input. And again, it will be a summarize of all our notes today from all the groups will be posted on the Miami Foundation website. Thank you. Have a great afternoon.